Mates. Today I am going to discuss the reproductive system diseases and disorder. So when we heard reproductive system diseases and disorder, what comes in your mind? So it will tackle the different diseases that have been experienced by the pig and reproductive system. So when it occurs. So, reproductive failure occurs when insemination fails to result in pregnancy or pregnancy fails to produce variable pigs due to infectious and non-infectious causes. So, in reproductive failure, it should be considered when a low conception or farrowing rate, irregular returns to stress, abortions, stillbirths, or mummies persist as an abnormal rate. And also, the normal rates for mummies and stillborns are greater than 0.5 and greater than 1 pig per liter. So, respectively, late-term abortions are classified as these occurring after 70 days of gestation. So, total abortion rate should remain greater than 2% of breeding group. So, there are common reproductive diseases and disorders of pigs. So, before I present to you the common reproductive diseases and disorder of pigs, let me discuss first the frequency of the occurrence as if um, there are one positive, it is only an occasional. And if there is two positive signs in the disorders or diseases, it is a common. And if there is three positive signs in the common disorders and diseases, it is a routine. So when we say occasional, it is not mostly happens. So it is matters to time, or if we say it also common, this is not also permanently diseases. So if we say routine, so routine is always occur when routine always occur as a diseases. So let me show to you the common reproductive disease and disorders. So these are the following common reproductive disease and disorders of the pig. So let me tackle that one by one. So first is the PRRS. PRRS it is usually results when susceptible swine are infected. It is most commonly transmitted by introductions of infected swine or contaminated for mice used for contaminated semen and aerosol. So the clinical signs of PRRS in a breeding herd start with an epidemic of abortion followed by an increase in viable piglets, stillbirths, and mummies. So the treatment for PRRS is supportive anti-inflammations to reduce fevers and antibiotics for control and treatment of secondary bacterial pneumonia may be necessary. Next is the PPV. PPV is sometimes described by the acronym SMEDI, stillbirths, mummies, embryonic death, and infertility. So, it is an exotic infection of swine breeding herds in the United States. The disease affects commonly in goats and younger parity sows. So, the clinical signs of PPV range from low total burns, mummies of various size, irregular returns to estrus and females, diagnosed pregnant but failed to farrow, and the diagnosis is based on vaccinations history, clinical signs, and PCR testing of mummified pelvos. So there is no effective treatment for PPV. However, commercial kill vaccines are available and very effective. So next is the leptospirosis. It is caused by infection by Escherichia bacteria. Infection has been associated with exposure of swine to contaminated soil or untreated surface water and exposure to urine from infected vectors such as rodents. Infected swine becomes carriers resulting in chronic diseases. So the clinical signs of leptospirosis includes pyrexia, low conception rate, abortion, stillbirths, and low viability peaks resulting in increased pre-win mortality. So the diagnosis is made using dark field microscopy or IHC performed in tissues, particularly kidney of aborted fetus or stillbirths. So the treatment with antibiotics such as charlatan tetracycline may be pursued. Commercial vaccines are available in all countries. So next is the PCV2. It is a ubiquitous virus in swine facilities. Pigs become infected with PCV2 through injections or oral nasal contact. So in addition, breeding females can become infected via insemination with contaminated semen. So girls and low purity cells are affected most often, whereas the boys show no clinical signs. So the clinical signs of PCV2 depend on the stage of gestations when the infections occurs. So PCV2 reproductive failure is diagnosed by the presence of viral and antigen confirmed by IHCR deoxyribonucleic acid is confirmed by PCR along with the presence of lesions in fetal tissue, notably myocardial noleralization. So, PCR testing of fetal thoracic fluid is sufficient to diagnose an utero infection of piglets. So, commercial called baculovirus vector vaccines are available and effective for prevention of disease but not infections or viremia. So next is the PRV. This virus was eradicated from the U.S. commercial swine herd in 2004. A comprehensive review is available. So it is a member of the herpes viridae family, and like other herpes viruses, infection can result in a carrier state or latency within nervous tissue with the potential or recrudescence. So, the clinical signs of PRV following acute infections include embryonic death, abortion, mummies, and stillborns at what have been shown to the default. So, the diagnosis may also be made through serology. A commercial ELISA test through serology, a commercial ELISA test is available and can differentiate between exposure to the gene-deleted vaccine and wild-type virus used extensively in the U.S. eradication. So, commercial PRV vaccines are available but only should be used in accordance in federal guidelines. So, next is the brucellosis is a genetic infection caused by the bacteria. Brucellosis is transmitted through direct contact with susceptible swine, ingestions of infected tissue, or fluids including milk and contaminated semen. So, these are the clinical signs of brucellosis. Infections in girls and cells include abortion with or without vaginal discharges, whereas boys have reduced libido and fertility. the U.S. commercial swine herd is Brucellosis sp. So next is the swine erysipelas. It is a zoonotic also gram-positive bacterium which is efficacious among swine. Erysipelotrix rocheopathia is the sole causative species. So the clinical signs including rhomboid, skin lesions, high fevers, lethargy, inappetence, withdrawal, and response to treatment with penicillin of affective sows and gulls are suggestive of acute and subacute NSE. Treatment involves injections of antibiotics and anti-inflammatories. Commercial vaccines are available and effective. So next is the CO, poison or the carbon monoxide. Poisoning induces hypoxia resulting in an increased number of stillbirths. Concentrations of less than 250 ppm are toxic. So the diagnosis is done by rolling out infections cause of stillbirth. So however, it is a definitive diagnosis is rarely possible because the contaminated feed has long been consumed by the time reproductive failure occurs. Next is the AAS, and seasonal infertility is a non-infectious cause of reproductive failure. The declining photoperiod and temperature fluctuations during the fall months results in declining progesterone levels. So the diagnosis is done by rolling out infectious causes and careful assessment of management facilities and reproduction records. Modern facilities that utilize gestation grates and evaporative cooling systems may improve but not prevent infertility during the fall months. So that's all of the common reproductive disease and disorders. So that's all of my report. So if you have any questions, just write down in the comment sections. That's all. Thank you.